Good morning. COVID-19 Delta variant. Reasons for its ultra speed spreading. Hey guys, SARS CoV-2 Delta variant is the most predominant strain of COVID-19. It is shown to be spreading very fast in the world. As of November 8, 2021, the Johns Hopkins Coronavirus Tracker calculated that globally the number of cases is 250,049,045 and deaths 5,052,494. Out of that, USA has 46,488,429 cases and 754,431 deaths. In India, there are 34,366,987 cases and 461,057 deaths. Almost 12,000 new cases in the US and 10,000 new cases in India are reported daily. This shows the huge power of spreading of COVID-19, especially the Delta strain. The Lancet of October 29, 2021, the medical journal published from London, Dr. Singanayakam et al. Showed that the Delta variant spreads very fast all over the world, even in places that have received vaccination. 23% in vaccinated and 25% among non-vaccinated population, and mostly in the same family. Dr. Y. Goldberg et al. Study published in New England Journal of Medicine in October 27, 2021 shows that the vaccine effects of BNT 162 B2 in Israel dwindles with time. Two reasons are forwarded for the explosive spreading of the Delta variant. 1. The viral load of Delta variant, and 2. The number of days the virus takes to infect a person. That is 4 days for Delta variant to 6 days for the previous strains. What is a viral load? It is the amount of virus being carried in the blood of a patient. In the case of COVID-19, it is the amount of virus in the saliva and other secretions from the mouth or the nose as aerosols, that is, small particles of saliva, etc., being thrown forward and gets in contact with a healthy person. In those diseases that are caused by bacteria, it is termed as bacterial load, as in case of TB. Dr. Baixing Li et al.'s unreviewed article published in July 21, 2021 Nature reports that they have observed the viral load from a patient to be as high as 1,260 times. The epidemiologist in Guangdong Provincial Center for Disease Control and Prevention in China, Dr. Jiang Liu, studied 63 people who survived COVID-19 of 2020 and 62 quarantined Delta variant patients and reported in Nature of July 21, 2021 that the viral load of Delta variant is at least double the number of familiar strains. These two factors, that is, the viral load and only 4 days for infecting a new person instead of 6 days, make this a super spreader, reports Dr. Singanayakam in the Lancet, October 29, 2021. Dr. Benjamin Cowling of University of Hong Kong supports it. A report of super spreading comes from Antwerp, a port city and the center of diamond industry in Belgium. Nature, February 2021. On December 5, 2020, the Hamilton Jack Care Home was celebrating its traditional Christmas gift giving. The residents and 40 employees sang carol songs, danced, and hugged Santa Claus, who came to this home from outside, accepted gifts from Santa, and enjoyed the dinner. This turned out to be a disaster, as reported in Nature, February 2021. 26 of the residents died of COVID-19 before Christmas. 100 residents and 40 employees, along with Santa, were tested positive for COVID. Another explosive spreading news comes from Boston that hosted a two-day international conference in 2020. 90 of its delegates and their close relatives contracted COVID-19. Geneticist Dr. Browning McInnes of the Broad Institute of MIT and Harvard in Cambridge analyzed the spread and found out that its share to Boston was big, 20,000 COVID-19 patients. And the report shows this to be very huge, 300,000 victims in Boston and nearby places from a single conference. The Antwerp Christmas party and the massive Boston spreading of COVID-19 shows that social gathering, community meals, etc. are very fertile ground for the transmission of COVID-19. Like these, the marriage functions, football matches, election speech, music concerts where people gather without social distancing and not wearing masks are hotspots for this spreading. Physicist Dr. Christian Kahler of University of Federal Forces Munich reports that when people sing or talk loud, the aerosols from mouth and nostrils will splatter forward 50 times forcefully. Since the lung capacity of women and children are less, the scattering of aerosols from them will be less forceful. The answer to control this viral spread is contained in the study itself. Keep social distance and cover mouth and nose during conversation, talking, singing, loud shouting, etc. SARS-CoV or severe respiratory syndrome that spread in 12 countries in 2002-2004 period. MERS, Middle East respiratory syndrome, Ebola, smallpox, TB, etc. show the same characters of spreading as COVID-19. The only difference is that they spread to only a limited number of people after longer time, says Dr. Erika Endo, the infectious disease researcher of London School of Hygiene. To save ourselves and those around us from being infected by COVID-19, we have to be vigilant still. A disease is controlled by research and medicine, not by some personal opinions. In front of us, we have scientific research investigations and hard work of thousands. In 2021, the world knows more about COVID-19 and is better armed with knowledge compared to 2020 when people were scary and not sure of its mode of spreading. Avoid spending more time in ill-ventilated rooms, music concerts, political meetings, shouting, singing and talking aloud. Practicing social distance, face masks that cover face and mouth will help us and this world from unnecessary and avoidable spreading. Wearing masks have shown to reduce respiratory allergies last year. So take care. Life is precious and cannot be replaced if lost or broken. Please like, share and subscribe my channel. Your comments are welcome. Bye till we meet again with another blog soon. Thank you, Edwin Williams.